Hello, NAAOP members and friends. Peter Thomas here, the General Counsel for the NAAOP, National Association for the Advancement of Orthotics and Prosthetics, here in Washington, D.C., coming to talk with you about three very important pieces of federal legislation that are currently pending before the U.S. Congress. All three of them impact the orthotic and prosthetic field in a very significant way, and NAAOP, as well as the large bulk of the O&P organizations in this town, very strongly support this legislation. The legislation, if enacted, would impact the Medicare program, the Veterans Administration program, and private insurance in a very profound way. And I'm here to walk you through those bills today and encourage you to go to NAAOP.org and click on the Legislative Action Center button to register your support with your representatives and senators and ask them to co-sponsor these bills. It's very important that we show grassroots support across the country, in every state, for these bills. And I'm here to tell you why. The first bill I'm going to talk about is H.R. 1958. It's known as the Medicare Orthotic and Prosthetic Improvement Act. 1958 is a very important piece of legislation that impacts the Medicare program. It essentially would do three things. It would link the ability to bill the Medicare program and to receive payment from Medicare with the complexity of the orthotic and prosthetic care provided, as well as the qualifications of the practitioner who provides that care. It's a very important bill. It would do things such as ensure that Medicare would not pay any unlicensed orthotic and prosthetic provider in a state that has O&P licensure. It would also refine and tighten up on some of the restrictions on accreditation in order to serve the Medicare population. The next piece of legislation is H.R. 805. H.R. 805 is entitled the Injured and Amputee Veterans Bill of Rights. And this is a piece of legislation that NAAOP has in fact championed for the past 4 years. The bill was introduced by Ranking Member Bob Filner from San Diego. And the bill would essentially ensure, or try to ensure, that veterans know their rights and know their expectations of what the VA healthcare system is supposed to provide them in the way of orthotic and prosthetic care. It would mandate that the VA publish a list of rights and post them in conspicuous places throughout the VA, including on their website, that would inform orthotic and prosthetic patients about things such as the right to the technology that is appropriate for the person's condition, the right to a practitioner of choice, whether or not that practitioner is in the VA or not, the right to a functional spare prosthesis or orthoses if that person needs it. The third piece of legislation is called S773, or the Insurance Fairness for Amputees Act. This was formerly known as the Orthotic and Prosthetic Parity legislation, and it essentially parrots many of the state laws that have been passed on the parity issue. It's called fairness now because, frankly, parity has gotten the name that has brought some political problems associated with it. The fact is that this is not a mandate to cover orthotic and prosthetic care in private insurance. But the bill does say that if a health plan decides to cover prosthetic and orthotic care, and most private plans do, that they cannot discriminate, they cannot impose arbitrary restrictions and exclusions on the O&P benefit that make the benefit unrealistic. In other words, they can't put a $500 cap on prosthetic care, for instance, and they can't go ahead and say this or that technology is simply not covered. Those are restrictions that don't exist in the medical and surgical areas of healthcare coverage, and they would be prohibited under this legislation as well. There are three important bills for three important payers of O&P services across the country. They impact patients just as much as they impact the O&P practitioner and professional. We strongly encourage you to reach out to your member of Congress and senator by clicking on the Legislative Action Center on the NAAOP website, NAAOP.org, and register your support, encourage your supporter, your senators and congressmen to support the bill and to co-sponsor these pieces of legislation. Thanks so much, and we will see you for the 5th segment in another couple of weeks. Thanks.